This presentation covers the environment of care for the DCH health system. The Joint Commission term for physical environment of the hospital includes the buildings, people, and the equipment within. We will look at 7 topics today concerning the environment of care. The topics include safety, security, emergency management, fire safety, hazardous materials and waste, medical equipment, and utilities. The objectives of environment of care is to provide a safe environment for patients, staff, and others, to minimize environmental hazards, risk, and injuries, and to comply with all standards and regulations. Let's look at safety. Safety at DCH Health System is everyone's job, including the Board of Directors, Administrators, Safety Officer, Environment of Care Committee, the individual department, and you. DCH has several safety activities, including risk assessment, education of employees, inspection, preventive maintenance, and testing of all equipment. We abide by all recalls. We do hazard surveillance rounds, policies and procedures, and any incident reporting. DCH is a smoke-free environment except in approved smoking areas. Approved smoking areas include the south and west parking decks in designated areas only at Regional Medical Center. There is no smoking inside. Let's look at security. DCH participates in several security activities. Those security activities include monitoring and surveillance of assigned posts, risk assessment, controlled access to certain departments, camera surveillance around each campus, employee education on security, identification badges, and policies and procedures. Security is provided by G4S, which is our 24/7 security team at the hospital, Tuscaloosa police officers, law enforcement agencies, and DCH employees. To report any security concerns at Regional Medical Center, you may dial 7320 to reach security control, or you can dial 22 and call code strong, code blue, or code red. At Northport Medical Center, you may dial 22 or 0. For security purposes, identification badges must be worn at all times while on the premises. Employees must wear their ID badges. They must wear it high above the waist. You must keep your name visible. All badges are color-coded depending on what department you work in. And volunteers, vendors, and contractors are also required to wear the identification badge while on site. Let's look at fire safety. To prevent fires at DCH, there is a no smoking policy, and there is preventive maintenance and testing of all equipment. For the fire response at DCH Health System, there is an acronym, RACE. R stands for rescue, A is alarm, C is for confine, and E is extinguish. Let's discuss the fire response plan for the acronym RACE. R stands for rescue, which is to reassure patients and visitors. You will rescue horizontally on your floor to move the patients away from the fire, and then vertically. And charge personnel will make decisions about the oxygen. A is for alarm. During a fire, you will need to pull the nearest alarm box, call out for help, dial 22, and call code red. C is for confine. Close patient doors and assure that all fire and smoke doors are closed. And compartmentalization, smoke and fire compartments for protection. E is for extinguish. To use a fire extinguisher, you would pull the pin, aim the nozzle, squeeze the handle, and sweep the nozzle side to side. There are several things you should know regarding fire safety tips. You should know the location of fire extinguishers. You should know the fire response for your area, and know the location of the pull boxes. Drills are conducted quarterly, and fire extinguishers are checked monthly by security and annually by an external company. Let's look at emergency management. Emergency management includes mitigation, which is prevention of emergency if possible, preparedness, which is training, policies, and community interactivity for internal and external disasters. Response is hospital-wide and department-specific response plans, which are scalable to the event. and recovery is to return to normal activities. Let's look at our emergency codes at DCH Health System. Code red is fire, code gray is severe weather, code strong is a show of force, code blue would be a medical emergency, code purple is a medical emergency of a child, code yellow alert is an emergency plan is to be implemented, code yellow active, an emergency is implemented, code white is lockdown, code pink is an infant or child abduction alert, and all clear is repeated 3 times after a code is clear. Let's look at hazard materials and waste. Hazardous materials and waste include the right to know, which refers to employees having the right to know if they are working or coming in contact with a chemical or hazardous product in their work area. Employees also need to know proper disposal for medical or biohazardous and chemical waste. Material Safety Data Sheets, or MSDS, are required for each hazardous material or agent on the unit. Each department or unit maintains their own collection, and each sheet contains information about properties, hazards, spills and cleanup procedures, and disposal instructions. Labeling chemical information for hazardous chemicals needs to include the product name, manufacturer, supplier, or importer name and address. It needs to list hazardous chemicals contained within, and it needs to have an appropriate hazard warning. Hazard substance include fire hazards, health hazards, and other hazards. You need to learn which materials are used in your job, including medications, cleaning agents, gases, and hazards. You need to know the rules of MSDS and proper labeling, know disposal requirements for medical waste, and know if safe handling and storage. Know if PPE is required. Let's look at medical equipment. Medical equipment is maintained by clinical engineering. You may contact clinical engineering at 7185 with any problems. And the Safe Medical Device Act applies to healthcare professionals and requires us to legally report any unexpected outcomes reasonably linked to a medical device. In the event of a power outage, DCH is backed up by emergency power. Receptacles labeled emergency or critical are powered by a backup generator. Receptacles should be routinely used for critical medical equipment, and the receptacles are red. Let's look at utilities management. You may report any utility problems to clinical engineering at 7185. DCH is on auxiliary electric power, which is activated in less than 5 seconds in a power outage, and you must plug critical medical equipment into the red plugs. Let's look at parking. Day shift employees at Regional Medical Center may park in the south parking lot, in front of Trustee Hall, in the laundry parking lot, and in the west parking lots located by the west deck. Parking is free in all of these locations, and there is absolutely no parking in the parking decks for day shift employees. Evening and night shift employees at Regional Medical Center may park in the same location as day shift employees, and are also permitted to park in designated employee levels in the south parking deck. It will be $2 to exit the deck if you park in the south parking deck during your shift. At Regional Medical Center, there is a prepaid parking participant list which allows employees to park on designated levels in the south parking deck if approved. You may contact Human Resources to apply for this waiting list. Employees at Northport Medical Center may park in areas outside the ED and outpatient entrance. Violators of the DCH parking policy may be subject to disciplinary action. Let's review some of the codes at DCH Health System. Medical emergency is code blue, B. Lockdown is code white, or E. Infant or child abduction is code pink, letter D. Fire is code red, or letter C, and severe weather is code gray, letter A. Let's review the RACE acronym. R stands for rescue, A is alarm, C is confine, and E is extinguish. Let's look at some other important information you need to know. The information we'll discuss is radiation safety, safe patient handling or back safety, and team communication and collaboration. Radiation has improved the quality of health care and its benefits are tremendous. However, large amounts of radiation may cause cancer and birth defects. To protect you, radiation exposure is strictly regulated by state and federal agencies. Most healthcare workers receive no more radiation exposure than what naturally occurs in the environment. It is important that you recognize sources of radiation in your facility and rules for working around them. This symbol you see pictured on the slide is one way to recognize radiation risk areas. Let's look at two sources of radiation. We'll look at X-ray machines and radionuclides. X-ray machines generate radiation when making an image. They have a focused beam, and they do not make patients or objects radioactive. There is not much risk around X-ray machines and patients who have been X-rayed for the average healthcare worker. Radionuclides are radioactive materials used in nuclear medicine to diagnose and treat disease. Patients receiving radionuclides may become temporarily radioactive and are kept in restricted areas while the radiation minimizes and the risk factors to others is reduced. In order to protect your back at work, let's look at three common activities: standing, sitting, and lifting. While standing, to reduce the stress on your back and muscles, flatten the arch in your back by bending your knees and putting one foot on a footstool. If you can't find a footstool, stand with one foot forward and your knees slightly bent. Alternate your feet every few minutes. Sitting puts more pressure on your spine than standing. To reduce stress on your back when sitting, move all the way back against the chair, keep your feet on the floor or footrest, and adjust the height of the chair so that your knees are slightly higher than your hips. Lifting places the greatest amount of stress on the lower back. Minimize back stress when lifting by standing close to the object, spread your feet wide to create a broad base of support, bend your knees and keep your back straight, hold the object close to you, and use your legs to lower and raise yourself. Team communication and collaboration. DCH fosters an environment of teamwork. Teams are important at DCH to cultivate a diversity of ideas, and teams are used to solve problems, examine potential efficiencies, and launch new initiatives. Since patients cross different departments, it is vital that departments communicate effectively with each other and work together as a team to deliver excellent patient care. Collaboration is when two or more of us work together to achieve common goals by sharing knowledge, resources, and learning from each other. Collaboration is celebrating our differences and being open-minded, and also finding new and better ways of working together. In an effective team, communication is the exchange of ideas and feelings in a way that respects everyone's contributions. Communication is a two-way process. It requires listening, and it requires honesty, sincerity, and respectfulness of others' opinions and beliefs. This concludes the presentation on Environment of Care. Thank you.